and welcome to Trendlines, a podcast on global affairs brought to you by World Politics Review. I'm Elliot Waldman. Before we dive into today's interview, just a quick reminder to tune in again on Friday for our editor's discussion looking at the week's top headlines. As the staggering death toll from the coronavirus pandemic continues to mount, less obvious but nonetheless dangerous threats are starting to rear their ugly heads. Depression, despair, extreme stress, and trauma are just a few of the secondary maladies that can flare up during a multidimensional crisis like this one. Today on Trendlines, we'll be talking about the mental health impacts of COVID-19. My guest is Dr. Susan Borja, Chief of the Dimensional Traumatic Stress Research Program at the National Institute of Mental Health in Bethesda, Maryland. Susan, welcome to Trendlines.
Thank you for having me, Elliot.
Is there any data to suggest that there have been changes in the number of patients reporting mental health issues during the pandemic, calling into mental health helplines, things like that?
I haven't seen any systematic surveillance data just yet, particularly on patients. We've seen that there's several polls from major news outlets and some brief self-report surveys, including ones from the Census Bureau and professional societies, and all of these are reporting some increases in symptoms. It's hard to say how that's going to translate into actual illness versus more transient symptoms of general worry, distress, and sadness. What we do know from prior disasters and large-scale traumatic events, including previous disease outbreaks, is that most people are going to have very strong initial reactions that include mental health symptoms. The good news is that most people are actually going to recover, particularly where their immediate needs, housing, food, connections to loved ones are met. But obviously not everybody's going to recover, and some people are going to have very enduring effects.
When you say enduring effects, what kind of impacts are you talking about specifically? What are the issues that you're most concerned about that we could see as a result of this?
Well, both in the short term and in the long term, there's a lot of things that we're worried about. In the short term, there's initial reactions to the virus itself. That could include fear of exposure or getting sick, contaminating your household for those people that have been having to work throughout this pandemic in healthcare, construction, service workers, transportation workers. And in the long term, there's all kinds of secondary effects. The social isolation and alterations in health-related behaviors caused by the mitigation measures that are aimed at reducing viral transmission do have an impact on folks, particularly for people that have, say, depression. We know that they tend to self-isolate, and the isolation from friends and loved ones that aren't providing that physical reminder that they are valued, that they're loved, that they're important, can be really, really damaging. Other long-term impacts, we worry about post-traumatic stress disorder. One of the things people do in the short term is increase their use of substances. And so we worry about substance use problems. We also worry about the effects of, having trouble sleeping or any of those changes in health-related behaviors that have more longer-term impact when you've not addressed something early on that you then are experiencing chronic illness.
You mentioned earlier that people who are more secure in their immediate needs, food and shelter, things like that, would be more likely to recover from the mental health impacts. What kinds of effects are we looking at among vulnerable and marginalized communities that were already vulnerable in terms of being sometimes food insecure, sometimes housing insecure, to shocks like the pandemic?
We know that poverty, just in general, can have significant impact on mental health. That when you are worried about how you're going to care for yourself, it's just a huge amount of stress, and your body is having that physical reaction for a prolonged period of time. And that wears on every part of your system. It wears on your immunity, it wears on your heart health, and it certainly wears on your mental health and your ability to cope and respond appropriately. And that comes out in lots of different ways. It may be depression, it may be irritability and anger. And so we worry about substance use problems, as I mentioned.
What kinds of interventions are likely to be the most effective to help people in those kinds of circumstances cope with the mental health impacts of the pandemic? You mentioned that we have experience from previous outbreaks of infectious diseases. So are there things we can take from that history?
Sure. There's things that, your listeners can be doing right now. And then there's things that they may not be able to do on their own, and they may need to have some help with it. So things that people can do on their own are things like as simple as setting a schedule, not being too hard on yourself if you don't meet it, but having some general routine throughout the day, and some goals that you're setting for yourself. Exercising a way that you can in your home or outside safely with a mask, eating healthy when you can, and then staying connected to friends and loved ones, setting hangouts by phone. We know that social support is very important. And it's hard with social distancing, but I hope that people are seeking out support, but also offering support, remembering to reach out to those people that may live alone, family members that may have less contact, those sorts of things. And for people that, may need some additional help, the first thing is just talking about it. I appreciate you having this as a focus of your podcast today, because we know that just acknowledging that people are feeling anxious and depressed is a really important aspect of just normalizing what we're all going through, and acknowledge that for a lot of people, this will be transient, but it's okay to seek help. And then the kinds of help would really vary for what the needs of that person would be.
You mentioned just now the setting of a routine as a potentially helpful thing that people can do. Why is that particularly useful?
Well, I think having something to look forward to is a nice thing, but then also having some ability to recognize at the end of the day what you've accomplished, instead of having just feeling a little bit unmoored and without a purpose. There's so much uncertainty with the virus right now that having the ability to control what you can control can be really helpful for folks.
Let's talk a little bit about treatment, because I know that a lot of people rely on therapy sessions, for instance, that before used to be in person and can no longer be anymore. How is the mental health treatment landscape being altered by the pandemic? And are the gaps there being filled enough to meet people's needs?
Yeah, that's a great question. So at the same time that we're seeing this kind of surge in needs from everybody in America, and frankly around the world, we're also seeing disruptions in the healthcare system. So in the best of times, our healthcare system gets to a lot of people, but it doesn't get to everybody. We know that there are gaps in services for certain populations in certain areas. So we know that we don't have enough child psychiatrists, for example. We know that in rural areas, finding a healthcare provider in your area is hard. And we know that there are populations, particularly economically disadvantaged, as well as minority communities, tend to have less services available to them. And so that's a real challenge of who's going to be able to get the help that they need. And with already having areas where the healthcare system is stretched, trying to meet an increased need is something that we need to start preparing for. We need to figure out how to leverage and extend the healthcare workforce that we have and get help to all of the people that are going to ultimately need it.
Are we seeing any kind of innovative treatment options crop up as a result of this? People doing, I would imagine, therapy sessions by Zoom, for instance.
Yeah, very quickly. I think the mental health workforce is a little bit better adept at being able to transition to a telemedicine approach versus, for example, healthcare that requires an X-ray. Most of our treatments are talk therapy that you can do by phone and you can do with telehealth. So that was something that we saw a lot of providers try to make that switch towards. We know that on the other end, not everybody has access to the tools and the technology or the familiarity for that matter. So elderly populations may not be entirely familiar with doing telehealth and having to use a computer or a phone to access their provider. And we know that there's a lot of communities where broadband access is limited, which can be a challenge as well. So there has been a shift. And I think that we have to figure out how to better use digital healthcare, whether that's telehealth, whether that's the use of apps or other kinds of innovative technology to meet some of these needs, but we also need to do the research to figure out how to get that to all of the people in all the communities that are going to benefit.
What kinds of impacts are we seeing on first responders who are on the front lines fighting this pandemic? I've read a lot about people just being extremely frustrated and sometimes even depressed at not being able to do very much for patients who come in critical condition, since the treatment options are so limited against this virus.
Yeah, first responders, healthcare workers are certainly one of the vulnerable populations that we're worried about. This isn't the first time that we've even faced a SARS virus. And we know from the prior outbreak in 2002, 2003, that these healthcare workers are at high risk. We know that they are working and they're used to being able to help. And there's a lot of uncertainty for them with what they may be exposed to, what they may bring back to their families. And then just the grind of having to try to figure out how you're going to help so many people and make a lot of really hard decisions throughout the day. We know that in some healthcare settings, there are things that healthcare workers are able to do, where hospitals are doing daily check-ins, where they are helping to monitor their workforce for symptoms and signs of stress and providing them with care that can help them be better healthcare providers and just healthier overall.
What kind of impacts specifically are we seeing from the economic fallout of the virus? We know that there are quite a few countries in the world where populations were faced with this very difficult choice of whether to self-isolate and forego payment, but then also risk losing their livelihoods or even starve in some cases. So what kind of mental health impact is that having?
We certainly expect it to be a stressor. And I think that you're right that we're having to choose lives or livelihoods. We think that right now, the public health mitigation measures that are in place that do have an economic impact are necessary for the virus mitigation. We don't have a lot of research into what are these long-term impacts of these public health mitigations and what is the trade-off that we're making in terms of mental health, in terms of what people are going to face for years, likely. And that's one of the areas that I think we need a lot more research to understand how to do these better, how to protect the health of the nation in all ways, and to understand both the benefits, but also any unintended consequences of the public health mitigation measures.
We've talked about things that individuals can do to safeguard their mental health during this pandemic. What are some steps that governments and policymakers, public health agencies can take to cushion the impacts of the virus and help citizens promote good mental health during the crisis?
I think that we need to get prepared for a surge. We need to make sure that our healthcare systems can provide stepped care. So some people may just need some information, and other people may need some brief intervention, and others may need routine care. So preparing for that continuum of services to address different levels of need is going to be important as we move into this next phase. We can also do what my agency does, which is research. I think that there's a lot of hope in new treatments and figuring out how to do evidence-based care in a better way, in a more efficient way, and how to get services to all of the people that can benefit.
Are there any final thoughts you'd like to leave us with, Susan?
One thing I haven't mentioned is that for people that are in crisis right now, that feel like they don't have anywhere to turn, there are resources that are available that are anonymous, that are free, 24 hours a day, every day of the year. One is the National Disaster Distress Hotline, 1-800-985-5990. The other is the National Suicide Prevention Lifeline, 1-800-273-8255, or 1-800-273-TALK. There's also a chat feature that people could use for the suicidepreventionlifeline.org. Both of those are great resources for anybody that wants to reach out and get some help.
That's a great point. Susan, thanks so much for joining us.
Thanks for having me, Elliot.
Dr. Susan Borja is Chief of the Dimensional Traumatic Stress Research Program at the National Institute of Mental Health in Bethesda, Maryland. If you'd like to comment on the discussion, ask a question, or even suggest a topic for a future episode, drop us a line at podcast@worldpoliticsreview.com. Trendlines is produced and edited by Peter Dury. You can follow him and WPR on Twitter. And while you're at it, don't forget to sign up for our free daily newsletter. It's the best way to keep up with what we're publishing, and you'll also get a code for a 25% discount off an annual subscription. To sign up, go to wpr.pub/trendlines. That's wpr.pub/trendlines. Thanks for listening, and tune in again next week.